Right now, on this Friday, we are going to take a look at your health, specifically prostate cancer. What are some updates in research, some new data to help individuals who suffer with this horrible type of cancer? Well, I recently spoke with Dr. Cheng, all about what you need to know. Let's take a look right now.
September is Prostate Cancer Awareness Month. 1 in 9 men will develop prostate cancer in their lifetime. Could their DNA hold instructions for discovering new treatments and understanding family risk? While genetic information has contributed to advances in treatment of diseases such as breast cancer, it has not been widely used in prostate cancer. Dr. Cheng is Associate Professor, Division of Medical Oncology, Department of Medicine at the University of Washington, and faculty member at Fred Hutchinson Cancer Research Center. She's joining us this morning to talk about the latest advances in treatment for prostate cancer and how she and others are working to bring more genetic information to the fight against prostate cancer. Dr. Cheng, thanks for joining us today.
It's a pleasure to be here. Thank you.
You are co-leading a new study to fight prostate cancer. Can you tell us about that?
Yeah, so the Prostate Cancer Promise study is an exciting opportunity, one of our most exciting projects, where we're partnering with patients, their care providers, and researchers around the country to learn more about the genetics of prostate cancer.
And how can our DNA... Oh, go ahead.
No, it's a pretty easy way to participate for patients. They can visit the website, which is prostatecancerpromise.org, register to participate from their home. They don't need to travel. They are then mailed a saliva kit where they can spit into the kit and then mail it back and then get hopefully very useful information about their genetics that can provide information about treatment options.
And how can our DNA help tell us how to best treat prostate cancer?
We know that there are genetic risk factors that can be inherited that increase the risk of prostate cancer. And these are important to understand because they can unlock new treatment opportunities, clinical trials for new treatments that we're learning about, and then also provide useful information for relatives as well. So an example I give is I have a patient who came to me. I'm a medical oncologist, so I treat men with various stages of prostate cancer. This particular patient came on hospice, came for a second opinion about treatment options, had no other options provided by his local oncologist. And I noted that he had a very strong family history of breast cancer, but actually no prostate cancer in his family. So we actually did genetic testing for him, learned that he had a BRCA2 mutation. He was then able to get different treatment, platinum chemotherapy, PARP inhibitors, and then actually had a remarkable recovery, went from being in a wheelchair to being able to play golf. And then what was also really important is that his daughters had opportunities for risk reduction for their own risk of breast and ovarian cancer. So that was really gratifying and one of the inspirations for this study.
Oh, that is really great news. So tell me a little bit more about which groups are more prone to prostate cancer and the study, how it's helping to treat those groups.
Yeah, thank you. So there are 3 main groups of men who are at higher risk of prostate cancer. First are men with a family history of prostate and other cancers. So I mentioned earlier, other cancers like breast and ovarian and pancreas cancer are also really important. If there's a family history of prostate cancer, the risk factor or the risk can go up 2-fold or 4-fold depending on the number of men in the family who have prostate cancer. We also know that men of African ancestry, so Black men, have a 76% higher risk of developing prostate cancer and unfortunately a 2-fold higher risk of dying from their prostate cancer. And then finally, veterans, our American service members, are also at higher risk. They have a 1 in 5 lifetime risk of developing prostate cancer. So a lot of men who potentially could benefit. Any man with prostate cancer can participate in the Promise Registry project.
And why should someone with prostate cancer consider joining this study?
I think there are 3 main reasons. I think it's very easy to participate. As I mentioned earlier, you can. It's also very urgently important. So we know that 1 in 9 men can be diagnosed with prostate cancer, or, even without the risk factors that I mentioned earlier. But this is really easy to participate in. You can do it from your own home. You can learn about your genetics. That information may be very important for your treatment. And then also for potentially for relatives too. And so I think for those 3 reasons, this is important. It's an exciting study opportunity.
It absolutely is. And where can we get more information and anything else we should know about it?
Yeah, so anyone who's interested who has a diagnosis of prostate cancer or a loved one with prostate cancer can visit the website, which is prostatecancerpromise.org. So prostatecancerpromise.org.
Thank you so much, Dr. Heather Cheng, for joining us today. I appreciate this important information about this prostate cancer study. Thanks for your time today.
Thank you.